All right. Well, thank you all very much for having me. And I'm going to talk about guns and gun violence. As you know, it was noted in the last presentation, guns are often really an exacerbator of other health problems, other things that people may be suffering with. And we can see this in physical health issues and with mental health issues, that access to a gun often creates what is a temporary crisis and turns it into a permanent tragedy. Because access to a gun, for several reasons, either prevents an individual from being able to receive the care that he or she may need because of self-inflicted wounds, or leads to systemic barriers from receiving needed care. And we see this more in the everyday gun violence in certain impacted communities. Some studies done in Milwaukee show us that for every 1% increase in homicide rates, there's a 3 to 5% decrease in access to pediatric care for children in that community, just because of fear. And it's legitimate, just fear of practitioners from coming into these communities to provide care, which is reasonable. So at Brady, what we're looking to do is attack this problem from its source, from its root. And we look at this in two ways. One is industry reform and actually making it harder for guns to get into communities. But the second, and what I really want to, and I'm happy to talk more about that in some of the Q&A or moderated questions, but really what I want to talk more about right now is an intervention around social norm change on what it means to bring a gun into the home and the risks posed of guns in the home. Some quick stats, since we're all numbers people around here, to throw out. If you have a gun in the home, an individual who is experiencing a temporary mental crisis, and so this isn't a diagnosed mental illness, but somebody who's in a temporary crisis, whether it's from an event that happens, an acute event that spins someone into tragedy, or a building cumulative stressors, i.e. financial stressors, relationship strains, is 300 times more likely to actually die from suicide than somebody who doesn't have a gun in the home. If that gun is not stored properly, they are 700 times more likely to die with an unlocked and loaded gun. If there's a gun in the home and there is a domestic dispute between two people, the woman in that situation is 7 times more likely to be murdered than a woman where there's not a gun. And if that is, again, if the gun is not stored properly, it's 10 times more likely that she's murdered, so if it's easily accessible. We also know that from an injury prevention standpoint, every day there are 8 children who are unintentionally shot with a gun that is found in the home, and those just 8 children who are unintentionally shot cost U.S. taxpayers about $1.7 billion over the lifetime of their care, because though the vast majority of them survive, they're living with lifelong treatment that's going to be required after it. So what we're looking to do at Brady is to change the perception of guns and address the risk that guns pose when you bring them into the home. And to do this, we started our End Family Fire campaign, and in a moment I'll show you one of the PSAs for it, but wanted to give you a little bit of the thought process behind this intervention. Then we'll go through the PSA quickly, and then we can talk about some of the actual impacted results that we're seeing. So when we think about guns and gun ownership, we know that it's a very emotionally charged issue, and that talking about guns often drives people into two camps, and you just get deeply entrenched into the idea of, it's my right to own guns, or nobody should have guns. And these two camps are essentially incompatible with one another. And so we came at this issue, though, rather than talking about the rights to own guns, we looked at what other risky behavior do we engage with all the time, and we have open and honest conversations about the risks involved with that behavior, but more importantly, open and honest conversations about how we can mitigate those risks and how risk mitigation changes after time. Cars are one of the most risky things that we all engage in. Getting behind the wheel of a car is dangerous, and people can die. And for a long time, a lot of people did die. But then we developed seatbelts. And as seatbelts became more common, fewer people died. And we now openly talk about the risks of driving and wearing seatbelts. From a pediatric standpoint, we talk about the types of car seats that you should be having your kids in and how that is age appropriate. Alcohol is another substance that many of us engage in that has risks associated, especially if you mix alcohol and cars. And so the designated driver campaign came out of that. And that doesn't say don't drink. It doesn't even say don't go out to a bar and get drunk. It says if you choose to engage in this sort of risky behavior, here are the steps you take to minimize your potential for injury or death. Similar to keeping alcohol at home as a parent. And the risk factors associated change as your family life changes, as your children grow up, and as your personal life changes. When you have young kids, the risk is unintentionally finding alcohol and drinking it because they're curious and they like to put things in their mouths. As you get older, it becomes more of teenagers trying to find it. And then again, if you have somebody in your home who may be in an emotional crisis, you might want to think about the ways that you are storing alcohol or have access to alcohol in your home. And so what Family Fire does as an intervention is to create the space for a dialogue around the risks of guns and the potential ways to mitigate those risks. And so with that, Claire, could you play the video real quick? Sound. There should be sound. I know, yeah. I'm glad I could provide this for you all, so you have your true workshop experience. Okay, yeah, I can keep talking. So, yeah, we'll pull it up in a second when it works. But some key points for this intervention that vary from a lot of other we look at gun violence prevention and really gun ownership ones is that it leans into the emotions that tend to drive gun ownership and people bringing guns into the home, primarily love and fear. We did quite a bit of research prior to launching this campaign, and what we found is that individuals, especially those who bring handguns into the home, bring them out of emotional decisions, not rational decisions. And the two prevalent emotions are love, a sense of wanting to love and protect your domain, and fear of bad things that might happen in the outside. And so when this is able to come up, you'll see that those two emotions are the primary driver of the PSA, and therefore also the primary driver of the discussion guides that we use to implement this program. And we're implementing it right now primarily with pediatricians and social workers. The pilot for this intervention has been focused on children and the risks that guns pose around children, primarily because it was a population that was quite frankly, a very easy inroad. It is hard to get people to counter the idea of saving kids' lives. You know, it doesn't matter where you fall on the political spectrum, where you fall on the gun ownership spectrum, nobody is going to say it's okay if kids get shot. So this was also a very easy entry point for us to be able to get partners in the social work and pediatric medicine space on board to engage with. And we're seeing incredibly encouraging outcomes. And so this program is only about a year old right now, so it's new. And I'm happy to share the data outcomes with anybody here who would like them. But from what we have tested in our interventions, all right, here we go. You ready?
I surrender.
All right, pal. Get ready for the day, buddy.
Hey, Dad. Hey, Dad. Do we have a gun?
What's that?
Do we have a gun?
Why do you ask that, kiddo?
Can I play with it?
No, absolutely not. It's not a toy. You know that.
Do I? I bet it looks like one.
Yeah, well, it's not. Anyway, I need it to protect you, your sister and Mom.
From what?
From bad guys, like on TV.
But what about the 8 kids who get shot every day by mistake? Their daddies probably thought they were safe too.
Where'd you hear that?
TV.
Yeah, well, maybe we don't believe everything we hear on TV.
Where do you keep it?
It's hidden.
I bet it's on the top shelf of the closet, under your sweatshirts. Is it loaded?
It's not. I keep the bullets...
In the boots with the red laces, and the chest beside the bed? I haven't found them yet, but I'm sure I can. You always told me to be curious. Remember when I found my Christmas gift? I'm a good climber, you know.
No, that's not what I meant. Look, I need to be ready if someone breaks in.
What about when it's just me and Mom? You taught me to be brave. I could use the gun to protect her.
No, Justin, I promise. I'll teach you how to handle a gun when you're old enough.
And what if I don't make it to old enough? I could get bullied and decide it's too much for me. It would be so easy with our gun.
Our gun? No, buddy. My gun.
But it is our gun. In our home. Happens all the time.
I'll make sure that doesn't happen. I'm always here for you.
But Dad, you're not always here.
Clear skies tonight with a low near 70. Increasing cloudiness tomorrow, sticky and humid with a high of 6.
Yeah. So on that cheery note, yeah. But so it leans into emotion, as does the discussion guide, because what we have found is that using numbers to try to get people to change behavior doesn't work. And we know that behavior change is important for other potential health risks to not be exacerbated and actually to allow people the space to get help that we need. So since the launch of this campaign and in the areas that we have been targeting working with social workers and pediatricians, we've seen incredibly encouraging results coming out of this. In the areas that we have, in the geographic areas that we have concentrated, which has primarily been the Southwest right now, and that was chosen because of a self-reported high level of gun ownership, as well as the Texas, New Mexico, and Arizona are the 3 states that have the highest self-reported levels of not actually locking up your guns if you have guns in your home. And among the parents that this has been worked in, over 40%, and this is in just the first 8 months of this intervention, over 40% report understanding why this is an issue, like internalizing it, understanding it, and seeing that this actually is a health issue for their kids. It's not a gun issue. It's not about gun ownership. It's actually about the health and safety of their children. And over half of those parents have actually taken taking active measures to store their guns more safely. And why this is important, if some of you may have seen, there was a pediatric study that came out last week in JAMA Pediatrics saying that if just a third more people in this country practice safe storage, you would save over 700 lives a year of children under the age of 12. And so, leaving on that positive, encouraging note, that leaning into the emotions works, that drawing off of love and fear works, and depoliticizing the issue and making it about the health and safety of the kids works. We're right now in the process of developing the next round of our toolkit, which is going to be focused on suicide in particular, and looking at actually the opposite end of the spectrum and looking at older adults and suicide, particularly when it comes to chronic depression and or terminal illness, and the ease of access to guns and the decision-making that leads to suicide. And we would welcome any collaboration of anyone who's in this room who'd like to work with us on that. And I will turn it over now.